Podcast disclaimer. The information shared in this podcast is for educational and informational purposes only and is not intended as a substitute for professional mental health advice, diagnosis, or treatment. Although a licensed therapist may be participating in this discussion, no therapist-client relationship is being formed by listening to this podcast. If you are experiencing a mental health concern, please seek help from a qualified, licensed mental health professional in your area. Do not disregard professional advice or delay seeking care based on something you have heard on this podcast. If you are in crisis or believe you may be in danger, please call 911 or contact your local emergency services immediately, or reach out to the Suicide and Crisis Lifeline by dialing or texting 988. Content and trigger warning. This episode contains discussions of sensitive topics that may be distressing or triggering for some listeners, including but not limited to mental health challenges, trauma, and other emotionally intense subjects. Listener discretion is advised. Please take care of yourself while listening. If you begin to feel uncomfortable or overwhelmed, consider pausing or stopping the episode and returning to it at a later time, or choosing not to continue. If this content brings up concerns for you, consider reaching out to a trusted support person or a licensed mental health professional. If you are in immediate distress or crisis, please contact 911 or the Suicide and Crisis Lifeline by dialing or texting 988.
Hello and welcome to All Things Foster, a place for coffee, connection, and community. Guys, we're in the second episode of a 4-part series on grief, and I'm really excited to continue this conversation with our guest from last week, Laura. But before we get to that, this episode is brought to you by West Texas Wellness Center in Amarillo, where your health and well-being are their priority. Led by Dr. Zach Parker and his experienced team, West Texas Wellness Center offers natural, drug-free, chiropractic care designed to help you live with less pain and more mobility. From neck, back, and joint pain to neuropathy support and customized wellness plans, Dr. Parker takes time to listen and create a care plan that fits your body and your life. Whether you're dealing with everyday aches, chronic pain, or just want to improve your body's natural balance, their whole person approach focuses on getting to the root of the issue, not just masking symptoms. Chiropractic care can even help improve digestion, increase energy, and enhance overall wellness by keeping your spine and nervous system aligned. Visit West Texas Wellness Center at Wolfland Square in Amarillo or call them at 806-352 to learn how Dr. Parker and his team can help you move better, feel better, and live better naturally. So, Laura, thank you for coming back. Week 2. I'm excited to talk. I say excited. It's a tough topic, but I am glad to get a perspective on grief because it's kind of an untalked about kind of issue with regards to foster care. And so before we get into that, remind our listeners or those that weren't able to be here last week, tell us a little bit about you.
Yeah, my name is Laura Bownds, and I'm a licensed professional counselor. I graduated from West Texas A&M University with my master's in counseling. I've worked in child and family services for the last 15 years, and I really enjoy being in this line of work. I think it is just very special work. It's an honor to be able to walk with families and kiddos through I would say, a journey. Sometimes it's a hard journey. Sometimes it's a happy journey, but a journey. Currently, I'm working with Cal Farley's Boys Ranch, and I'm really enjoying that. And then I also work as a counselor in private practice. And so just being able to talk about this topic is really important. Kind of where we left off and talked about in our last segment was just how we don't always talk about grief. We don't always talk about feelings related to grief because a lot of us grew up in a time where maybe you didn't talk about it because, we're not supposed to talk about feelings and emotions. But we now know that it's important to talk about things. It's important to have an emotional outlet for things that affect us.
Yeah.
And so I'm really excited to be here today.
Yeah. Well, I'm glad you came back. Stick around for another episode. And we're going to have 2 more episodes after this one, guys. But we talked last week just about, there's kiddos are struggling with grief. They've been removed from their normal, even though probably a lot of folks would not consider it a healthy environment. It's their normal. And so when they're taken out of that environment, it's scary. They don't feel safe, and they're grieving a loss. Oftentimes they're grieving the fact that they're not in the same school. They're not even in the same county. Maybe they're not even the same. They're not even in the same state. They get sent to Arkansas to live with a distant cousin or something like that, or just a different part of the state of Texas or whatever. And so there's a lot of grief associated with the kiddos and what they're feeling. Mm-hmm. Today we're kind of talk a little bit deeper about grief, kind of set the stage because grief is not just, there's lots of different kinds of grief, right? In regards to this environment of foster care and adoption, right?
Yes. I think particularly in regard to grief, it's important to remember just the attachment styles. And for what we're talking about today, I kind of want to talk about and put a focus on ambivalent attachment, because that is what I think a lot of our kiddos that come into care kind of struggle with, is missing an unsafe caregiver at the time, being removed from the home because something's not safe, right? And helping them to understand there is this, I think, inward conflict of, I miss this person, I'm hearing that they weren't safe, and understanding that and walking through that with the child, because that loyalty kind of conflicts with, the I love this person, right? And understanding that the environment wasn't safe. And so it creates this emotional distress. And so helping to normalize for that child, you can miss someone and still need to be safe from them. And helping them to also understand you can love someone and still need to be safe from them. And walking them through the emotions that are correlated with that. So we may see, more meltdowns in toddlers. We may see some, I would say, maybe aggression at times, whether verbal or physical, and trying to help them to navigate those challenging emotions behind that behavior. Because again, behavior is communicating something to the caregiver, right? And so that's so important. I would say just kind of a statistic that I read is, over 50% of youth report longing for their biological parents even after removal. And that's important because that means that, every other child that might come into a caregiver home, and I actually probably would believe that it would be more than 50%. I think so. They're going to need that support. They're going to need someone to kind of walk them through that. And it is hard as a caregiver to have our own feelings and feel a certain way about an unsafe environment, right? But being able to separate that, because, lots of times there are underlying circumstances of why that unsafe environment occurred, right?
Yeah.
And so being able to separate that so that we can walk this child supportively through what they may be feeling, right?
Yeah. I'm 45 and I was adopted at 2, and my biological mom found me years later. That relationship was not healthy. But she didn't know who my biological father was. And so even at 45, I've been dealing with this for 43 years. There's still times when I grieve the fact that I don't know who my dad was. I know who my adoptive dad was and love him to pieces, but there's this ache for this person out there. My brother paid for me to do one of those DNA things or whatever. And this was years ago, and I still periodically get emails to my email where it says, hey, we've added new family members, and I'll go in there and I'll look for it, and there's just this little piece that says maybe I'll find him, and so that doesn't mean that I didn't love my parents and all these different things, but there is, like, and I like how you put that, where you can love the person and it still not be safe. And we as foster homes, as adoptive homes, need to be cognizant of this kind of dissonance between the inside this kiddo who, yeah, I love him, and it wasn't safe, right? Yeah.
Something that I think is really important here is that I think as honest as it is appropriate to be, and again, looping in the therapist when those hard conversations come up. But I do know that, as honest as we can be for kiddos is so important. And helping them, because kids can tell when you're not telling the full truth, or when you're not, when you're kind of beating around the bush. And it's important that they know that when they hear from their caregiver, they can believe what they're saying. They can trust what they're saying. Yeah. Because when we're not clear with our kiddos, it leaves them in a place where they don't know. And so some of the feelings and emotions that we might not see as excessive, I would say, as far as the negative emotions, we could kind of calm some of that with being honest and giving them as much information as is appropriate. Right. And I think, again, looping in the counselors so that they can help with some of those conversations is important too. But I do think, it's normal to want to know where you come from. It's normal to want to know the history of your life. And, I think those are questions that, for kids, when it's appropriate, we need to be open with them about those things. And so, I think some of the normal, just grief that is going on internally is perpetuated even more significant because of this inward conflict of, I want my caregiver, I want my home, but I can't be there because people are telling me that it wasn't safe, or that, I think we need to be very careful when we're talking about, the biological parent in terms of saying they did something bad, and being able to help kiddos, not to have information that's appropriate, that's, therapeutically appropriate, but also, helping them to understand that they did not do something bad, that they are, safe now, and that it is understandable and it is normal for them to want their mom or their dad. And it really is heartbreaking to think about what kids go through during that period. And so that's why I think it's so important that we're doing this podcast, just to educate and help caregivers to understand that these are hard topics and these are not easy conversations. But also, at the end of the day, we just want to make sure that the kiddo is doing okay, and can understand things, in a way that makes sense to them. But we also definitely do not want them to, feel bad about themselves or create a situation where they are beating themselves up for something, or, just having open and honest conversations that are therapeutically appropriate.
Right. Yeah. Well, let's talk, because there are different types of grief in this continuum, really, between all the different things. So let's start with the child's grief. So sometimes you might miss people who hurt you, and that's confusing, but that also doesn't mean that there's something wrong with you. It means that you love them, right?
Yeah. And I think it's important to just kind of talk them through that and just be open and honest about what their feelings are related to that. Sometimes, as foster parents, you can have your kiddos name their grief, and they can be able to talk about, I'm feeling angry today. I'm feeling sad today, whatever that may look like for them, but being able to name what they're feeling, because that's so important. And then being able to walk them through, coping mechanisms for whatever feeling that may be.
Yeah.
So for some kiddos, that may be that they need to maybe write a letter to mom. I really encourage this to specifically occur in therapy a lot, because some of the things that they may want to write, they may not want to share. And it's nothing against the caregiver.
Right.
It's just something that, that they may not feel ready to share. Or may just want to share with the therapist, and that's okay too.
Right.
I think something that's important for the caregiver to know is just that, that kiddo felt open enough to tell you what they needed, and just knowing that they're going to take those steps that you're giving them, but you don't necessarily have to be a part of, whatever that may look like. And I think also, giving the child a way to talk with you about hard conversations. So, sometimes kids don't want to say, I'm feeling really angry about this. And so sometimes some families will create a code word. And I know it sounds kind of cheesy, just to be able to say, this is code for when I'm feeling this way. And these are the three things that help me: being left alone, sitting and having a talk, going for a walk. Those types of things can be really helpful. I think also it's important, to help kiddos understand too, that this is a normal feeling. Everybody feels this way, and being able to relate it to other parts of life too. So they may be feeling grief being removed from their home and placed in a new home, but other people sometimes feel grief whenever someone moves away. Other people feel grief whenever they change their situation. Maybe it's a job, or maybe it's, sometimes people change churches, sometimes people change schools, those types of things.
Yeah.
So I think that's really important too. But I do think that, whatever you can do to talk about it is so important in the home, especially because if the kiddo is coming to you and wanting to talk with you, that means that you've created a relationship and they trust you.
And they feel safe.
Yeah.
Yeah.
So that's
Because
important.
they're opening up to you. That's, yeah.
I think also being able as a caregiver to maybe talk through conversations, even if you don't understand what they're feeling. Because some people, we're all different in how we feel about, different circumstances, right? Some things that other people do, I may not understand and never be able to fully understand.
Yeah.
But I still can listen.
Yeah.
And walk through whatever those feelings may look like. And I think each kiddo needs to have that opportunity as well.
Do you think it's important to note that a parent, even if let's say a parent that was a foster kid themselves and then was adopted and things like that, do you think it's important to note that they may think, I know what you're going through, I know what you feel, but do you think it's important to note that that's probably not the best thing to say?
Yes. I think lots of times that has the best of intentions. I know how you feel. But I think sometimes it can be off-putting, for lack of a better word, to some kiddos.
Yeah.
Because, how do you know how I feel?
Right.
And kind of helping them to openly talk and freely talk. Because I think when you say that statement, it kind of puts a limit on how they might be able to feel. Because you know how they feel and you know how you feel. But being able to just say, that must be really hard.
Right.
Being able to validate how they're feeling and not minimize how they're feeling.
Right.
Letting them have that opportunity to explain and talk and discuss all of the feelings, emotions, thoughts. And even if they have ideas of, what they wanted this to look like and it's not looking like that, and just being able to sit there with them and let them have that.
What do you think about say a parent that's fostering, that's adopted? What do you think about saying, I went through something and this is how I felt, that might try to give the kiddo some language? You know what I'm saying? I'm not saying I know you feel this way, but this is how I felt.
Yeah. I think when you put that specific perspective on it, it makes it more therapeutic in terms of the kiddo being able to say whether there are similarities or differences in that, and being able to recognize that, and, feeling heard, because you're explaining what you've been through, not saying I know how you feel, but just saying this is how I felt. And it's different in that way. And I think that is a much more appropriate way to kind of, have those conversations. They want to be heard.
Yeah.
And I think specifically in these situations where things are hard and the conversation just feels maybe overwhelming at times, just to have the opportunity to have someone just be there with them again. And I know it sounds so small.
Yeah.
And again, we're fixers, we're helpers.
Right.
But in those moments, silence can be very therapeutic also.
None of us went into this with this idea that, I guess I should say it this way. Most people that go into this because they want to help kiddos that are struggling make it through, right? But when we try to step in and fix things, usually doesn't go well.
No, and I think that, brings us kind of back to the kiddos having some control too. And I think it's important to recognize that is something that is one of the things that they get to have authority over, right? And it's not even a lot of control. It really is just how they feel or what they think they want this to look like. And so I just feel like it's something that if we can give them as much control as we can give them back is very important.
Sure.
And then also really allowing them, to kind of work through what would make them feel better. I think sometimes we feel like we have to just let them kind of work through things on their own, or, it's a question worth asking. What would make you feel better? Just to see what they would say.
Yeah.
And they may not know.
Yeah.
And if they don't know, then you kind of just continue to talk, or, if silence is feeling right and it doesn't feel right, it feels uncomfortable, but that may be what the kiddo needs. But just, letting them have the opportunity to express what they need to express in the ways that they need to express it.
Sure.
Yeah. And I think also, something else that can be hard for caregivers too is knowing that someone hurt them and they care about this child,
right? And
not holding, knowing those feelings are there and being able to separate those, especially in these conversations where a kiddo might be showing an emotional, they might be tearful, they might be, noticeably hurt. And so I think we always want to protect kiddos and we always want to be able to be there for them. And so we can, again, validate even if we don't understand. And then also avoiding minimization of what they may be going through and letting them speak it in the language that they want to speak it in. And then also just inviting them to let those emotions out. So if that is drawing, if it's talking, if it's going and doing something, that's really important.
Okay. So we've kind of talked a lot about the grief that the child is looking at. What about foster parents? Because they have grief too.
Yes, I think that's really important too. And I don't think we talk enough about that either.
Yeah.
Because we have kind of a systems approach with that, kind of in regard to, kind of signing up for a position.
Yeah.
And, but we're dealing with human emotions,
Yeah.
right? And so it's only natural that a caregiver is going to feel a certain way for a kiddo.
Yeah.
And so that I'm really excited about, just kind of talking through some of this, because I think it's important to normalize that a foster parent, a caregiver would feel sad when a child leaves. A foster care provider or a caregiver would feel upset if someone hurt a child that they cared about, or, there's just lots of different situations and examples where it's normal for us to feel a way that we feel because we care.
Right. And even, and so like holding space for the fact that, let's say that, the kiddos come into care, biofamily really does the work and really gets to where they need to be. And so the foster family is very comfortable with and glad that they're going back to a really positive environment and still feel grief over it.
Right. And that's one of the things that I feel like sometimes foster parents don't feel like they can express that, because then if they express it, then it means that they're not doing their job right or they're doing something wrong. But I think it's important that, we talk about it, because it would only make sense that someone is going to be sad because they miss someone who was a part of their life for, however long that was.
Yeah.
You think about it, when you have family come and visit, they might stay 2 weeks, or when you have like an old friend come and visit and they may stay a couple of days, you miss them when they leave.
Sure.
And so the amount of time that, families are with these kiddos, it is a hard transition. Yeah. And it is something that I think that, people have to take care of themselves. And so, going to therapy, if that's something that they feel like would be helpful. I'm a therapist, so of course I feel like it would be helpful, but also, self-care for them. So if that is taking time that they need to take to grieve and feel those emotions, what happens if we don't feel emotions is that they kind of bottle up inside us, and it's like a pressure cooker.
Yep.
And, at some point it may just be some minor inconvenience, and it is a huge blow up because the feelings never came out. And so we really, really want to focus on making sure that we're getting those feelings out and being able to talk about it through maybe, if they belong to a support group.
Yeah.
I know that most caregivers and foster parents have an agency that they belong to, and utilizing the staff within that agency for support and being able to talk about things. I know that there are some agencies that do offer counseling services for a certain amount of sessions for them to be able, specifically when reunification happens or when a child is adopted, to be able to talk about those things. One of the things that I think really helps foster parents is if they can continue to have that relationship with the child, because it makes a difference, and so I think also being able to know how the child's doing or getting updates or those types of things can be really significant too.
Yeah, it can. There's this big unknown, and so then you worry, how are they doing? Are they safe? And all these kinds of things. And so when there's not, kind of a follow-up, checking in, saying, hey, he or she's doing great, and, whatever, then it does. When someone dies and there's grief, and okay, they're gone, and I can grieve that, and I can try to move past that, right? But then when this child leaves and you don't know, and you worry about them, it's kind of this open wound that just festers. It can be,
Yes, for sure. And I think, our minds like to fix problems.
Yeah.
And so one of the things that our minds do when we don't know something is they're going to try over and over and over to solve that problem. And that's when, all kinds of thoughts come into the mind, and being able to, I think, caregivers have to assess their emotional capacity regularly, because that's really important too. And it's important to take breaks as needed, specifically in between placements, to allow for a period of, the grief process, and also, just a reset. Because I think it can be a lot. It can be overwhelming.
Yeah. And something I'm just thinking about here as we're talking about this, because, the foster family, the foster parents, they go into this and, and they build these connections, and then the child leaves, and then they, and then they're hopeful that it's good, and, maybe it is, maybe it's not, whatever. But something we didn't talk about before now is the grief of the other kiddos that are in that home, that have built these strong relationships with the kiddos, and then they're they're not there anymore. Those other children in that home, they struggle with that grief too.
Yes. And I'm glad that you brought that up, because that's a really important piece to all of this, is just being able to provide, tools for kids in the home as well. And I think, again, we go back to what we feel as adults, right? And so kids thinking in terms of a larger scale, we may see behaviors with our biological children after a placement leaves because they're missing them.
Yeah.
And they don't know how to communicate that. And so giving opportunities for the child to miss them, whether that's, we're going to write a letter to the kiddo that just left, or these are some of their favorite things and I want to remember them. So we're putting it in a box to remember them, or, drawing them a picture, or maybe it's, they're not here anymore, but we're still going to eat their favorite meal, like it was mac and cheese night when they were here, spaghetti night, taco night. So we're going to do that tonight, and incorporated the memory of that into the home, because that is okay to remember. I think it's very special to remember. I think also, reminding kids that it is okay to feel how you're feeling. And again, the same thing that the caregiver would do with a kiddo placed in their home, doing those things with their biological child to let them know it's okay to feel these feelings. Some of them are really, really hard. And then, of course, looping in a therapist whenever, they feel like it's needed.
And maybe checking their pulse too, to, say, okay, well, we need to take this break for a month, 6 weeks, 2 months, whatever. But then maybe it's not only mom and dad need this break, but maybe my child needs this break too. And you're pulled in 17 different directions because you're getting phone calls every other day saying, we got this, blah, blah, blah. And so you want to jump in, you want to help, but you also, you want to have time to go through the grieving process for yourself. But then if you're whatever kiddos are left in that home, they need that space to grieve too.
Yes. And to think about all these different perspectives and just roles within one situation. I mean, there's a lot of feelings there. And it's important to recognize that. And I think as a parent, again, you want to fix something that really can't be fixed, and just kind of, normalizing that. And giving some control of that to the child, where they can, you can ask them, what do you think would help you to feel better? And walking them through that, walking through that with them. And, kids are resilient. And I think kids see things differently than we as adults do, in terms of, kind of remembering situations, or even just in regard to having someone in the home and then they leave to go home, and how they understand that in their mind. And so I think something that, can be helpful too is if there is an ongoing relationship with that child, also looping your kids in with that, and being able, so that they can see, the kiddo in our home went home. And here's what they're doing now. And we're going to meet them for ice cream or something along those lines. When that can happen, we do know that an ongoing relationship can be very beneficial for the child placed in the home and then also the foster family. When that's able to happen.
Right. And vice versa. Let's say that the parents' rights are the relinquished or they're terminated, when it's appropriate to have some level of connection with the biological family as well, if it's safe and all the things.
Yeah.
So, and that kind of helps with the grief as well.
Yes.
Because again, we stress about not knowing how they are once they've gone back to the biological family, but the kids stress about wanting to know how their mom or their dad or their grandma or whatever, whoever it was that they were with when they were removed, how they're doing.
Yeah.
So
I think you also think of it in terms of, not just the kids in the home, but also grandparents, aunts, and uncles that developed a bond with that child. It really is kind of a whole family situation. And so I think that can be really difficult. And that's why expectations from the beginning are so important. What does this look like for our family? What what is our goal with, starting to provide foster care? Do we want to be a foster family? Do we want to be an adoptive family? What does that look like? And being very clear about that, just so that you can also ensure that you are not getting into a situation that may be really emotionally difficult.
So then we talk about, we've got the grief from the child, we've got the grief from the parent and the other kiddos that are in the home. Let's talk about disenfranchised grief.
Yeah. So disenfranchised grief is, when we talk about disenfranchised grief, so sometimes people don't understand why you're sad, but your feelings still matter. And so just thinking in terms of, specific to foster parents, maybe, a friend may not understand what they're going through. And it can be really hard to kind of communicate these things. And I think that's why, support groups are so important, and being able to have that village around you that understands. I think it makes a difference when someone goes through something, that is similar and you can kind of gauge, just how they're feeling in terms of what has made it better, what made it better for you, that type of thing. But I think when, we talk about disenfranchised grief, just understanding that, their feelings matter. Not everybody may understand, and that's okay. But this also can lead sometimes to emotional suppression where people won't talk about these things because they don't think anybody will understand. And they're feeling all of these challenging feelings, and that's really hard to feel something that no one understands. And then also somatic symptoms. So where we're seeing, physical complaints based on feelings. And so it's really hard because maybe waking up in the morning is really difficult to get out of bed because of feeling the grief or the sadness associated with that. And then also dissociation and, not really thinking about what has occurred and trying to think about everything but what has occurred, So I think it's really difficult. I think we have to find our village and people who will understand. This is why I think it's so important, for people who have fostered for a while. When I think it's a beautiful thing when they mentor other people coming on to foster, and helping them to know that they have been there because most likely they've had a child that has left their home, and helping them to understand, that it's normal to feel sad. It's normal to feel grief about that. And that means you love them. I think there is a Winnie the Pooh quote that sometimes almost makes me cry, but it's something along the lines, how lucky am I to have something that makes saying goodbye so hard? And it's a beautiful quote, but it's also, very sad too.
Yeah.
And so I think just having that person that understands and that won't minimize what they're feeling, that will help them work through it and just be a friend to them and somebody that they know that they can talk to. And I think also, going to therapy is always helpful. Being able to talk about their feelings. And I think sometimes it's important to remember too that that there may be an array of emotional feelings that someone may feel.
Sure.
And it is okay to feel how you're feeling. It may not feel good in the moment, but also that's okay. And using what you feel like will help you to get through that. So if it's talking to someone else who has fostered before, if it's talking to a therapist, if it's going to a support group, a foster care support group and talking through things, if it's the church pastor, I know a lot of foster parents who utilize their church family for support. And I think that that's a great thing too, but it is hard to get past if you're just kind of getting stuck there.
Yeah.
And so I really encourage, always thinking about ways to get those feelings out.
Yeah. Whether it's talking to a pastor, talking to a friend, talking to a counselor, writing it down, whatever. But like you said, not just stuffing it. Oh, I've run into foster families who kind of run off of a, they kind of deal with the grief of the loss of that child by replacing that child with another child, and it becomes a cycle where they're they've had 5, 10, 15 kids, and kind of the grief just gets, for each one, just kind of gets ended up being amplified because at some point they just collapse,
right?
And now they're, rather than dealing with the grief of each kiddo moving on, they take more kids, and while it's a beautiful thing, it's detrimental, right?
Yeah.
To basically not feel the feelings, move on past the feelings without ever working through them, and taking new kiddos in.
Yes. And that brings up a good reminder of, not getting stuck in autopilot. Because I think sometimes when we want to avoid feeling things, then we're just going to keep going. We're not really thinking about things.
Yeah,
we're not really. Yes, exactly. And so, that's not healthy for anyone in any situation. Yeah. And so kind of being able to say, okay, what do I need? I really would encourage foster parents after each placement to be able to kind of take an inventory of where they're at.
Yeah.
And just kind of seeing, what do they feel like they can handle? Where are they at as far as, I would say the grief process, but also, as far as being able to provide self-care to themselves. Is there something that they've been wanting to do that they've put off? Because, we all do that whether it's, our kiddos or a job or, finding the time to do something that we really want to do, we keep putting it off. But being able to do some of those things in between placements, being able to really think about, where they're at and what, what kinds of things they may need to do before they take another placement. Is there something, I've had foster parents tell me we just need to take some time to heal. Yeah. And I get that. And I can understand that. Yeah. And I'm proud of them. I had someone say to me one time, this was a long time ago, but I had overcommitted myself, and I had said to them, I'm just not going to be able to get it done. And they looked at me and said, congratulations on choosing you. And so I would tell those foster parents, sometimes you do have to choose you.
Yeah.
And I think when a child leaves and you have that space to be able to say, okay, we're going to hold and pause for just a moment, that's really important. But we have to be able to communicate that, because only we know our limits.
Yeah.
And just kind of identifying, how they're feeling, where they're at, what are their needs, what are some things that, they may have struggled with this last time that they were fostering that they want to do better, or, kind of looking at those things.
Yeah. Take that inventory and yes, we care about the kiddos and we don't want them going all over the place, and we want them to be safe and all the things. But at the same time, if we're not in a good place, then we're not going to be a good place for the kiddos ultimately, right? So what are some things other than kind of the things we've talked about? What are some other tools that they might use to kind of work through some of this grief? I mean, we talked about writing. We talked about maybe a pastor, a friend, counseling. Are there some other tools that you've seen that are really helpful?
Yeah, I think, of course, we talked a little bit about self-care, but being able to, if they have a spouse, kind of relying on their spouse to talk through things, utilizing people in their support network that, they feel really lift them up, help them to feel better about things, help them to work through difficult emotions. Yeah. I think also being able to, we all know the mind-body connection. So if they exercise, if they eat right, if they get plenty of sleep, those types of things are so important too. But I also think, just again, being able to have the space where if they want to talk about, what they're feeling, they're able to without judgment.
Right.
Because whenever we feel like we shouldn't feel this way, it creates guilt and shame.
Yeah.
And when you're already grieving, that's just adding additional difficult feelings on top of that.
Yeah.
And so I really encourage foster parents to talk to someone who they feel will understand, like we've talked about before, to someone who they feel like they get good guidance from. So maybe a pastor, or if they are in therapy, talking to their therapist and working through any of those feelings that they may be feeling. And again, this is just something where if you avoid these feelings, if you avoid talking through things, it just continues to accumulate. And the goal is to be able to get all of it out. And I always think of it too, you don't do anything you wouldn't want for your kids, to feel or do. And so, as a parent, you encourage your kiddo to go talk to a friend or to,
talk to you or something.
Yes.
Do something.
Yeah.
Yeah.
Those things are really important.
And then we do it ourselves.
Yeah. Yeah. So, but I think one of the things that is really important to remember is just, this is normal. There's no right way to have a discharge from your home. There's not a way to do it without having feelings. And if someone didn't have feelings about, those situations, we'd be worried about them.
Right. Yeah.
We want for people to care.
Yeah.
We tell foster families, you have an extra space at your table, open your heart in your home. And you can't just tell someone to turn those feelings on and off. Yeah.
Yeah. Because they say, a lot of folks say, well, I could never do that because I would love them too much. And it's like, no. I mean, foster parents are not superhumans. They're not, they have feelings and they get attached and they need to get attached in order for that kiddo to feel safe and seen and loved and all the things. And so it's natural for them at the end of it to need to grieve. And so I just think, like we've said it several times, but normalizing the fact that it's okay to feel grief, from from everybody. So, all right. Well, we've had 2 really great episodes on grief from the various, trying to understand better the grief from the kiddo, and then the grief from the rest of the family. And so next week, we're going to kind of talk about how does grief show up? What does it look like? And we're going to have another guest on, right? So why don't you give us an excerpt about her?
Her name is Diane Samaniego. She currently works at Amarillo Children's Home. She's the director of their transitional living program in SIL. So something really neat about Diane is that she has the house parent perspective because she's been a former house parent. And then she also has 2 adopted kiddos. And so just hearing from her, I think will be very beneficial. And so I'm excited. I think it's going to be great. And I've really enjoyed talking about this topic. I want for us to get to a place, I want for us to be the generation that says, hey, we're going to talk about feelings and emotions. Yeah. It is okay to tell us how you feel. It is okay to have these feelings in general. So thank you for letting me be a part of this.
I just really appreciate, again, it's taken a lot of time to put these conversations together and then to sit down and have them. And so I know you've got your own work to do and all the things, and I really appreciate you taking the time to be willing to come in and talk with us and try to help us work through some of this. It's just really important. So guys, thank you for tuning into this episode. Make sure to like, share, subscribe, comment where you're listening from. That'd be great to just kind of see where everybody is at. And guys, we do placement packages. That's our main gig at Panhandle Orphan Care Network. We launched this podcast just close to a year ago, and it's been great to have a bunch of conversations and really have some positive things happen, I think, from this podcast. But our main gig is the placement package. And so kiddos come into care oftentimes with the clothes on their back. We did a placement package recently for a little girl. She came with the diaper she had on and 1 sock, and that was it. That was all she had. And so we step in and provide a placement package. So every kiddo gets a suitcase, a Bible, a teddy bear, book, toy, and blanket. Every kiddo gets that. And then over and above that, it's customized based on the specific needs of that family and that child. And we can't do that on our own. It takes volunteers. It takes businesses hosting Moses Closet drives. It takes funding from all the different sources. And so one of the things that we ask is for folks to consider becoming a placement package partner. And what that entails is setting it up in your, just go to our website and you set up once a month. It's just going to come out of your checking account. You just don't even have to think about it. $100 a month buys us all the clothes we need for 1 placement package. And $50 buys us a case of diapers. And then $10 a month buys us an outfit. And all those different things really help us to begin to grow. There's over 600 kids that come into foster care in the 26 counties a year. Last year, we did 161 placement packages, which is double what we did the year before. So we're excited about this growth, but we've got a long ways to go to get to where every kiddo gets a placement package. So we need your help to get there. So if you're interested, go to our website, panhandleorphan.org/donation. Get that monthly donation set up. It'll help us to continue to grow, to provide more content like this, and then also to more and more placement packages. 5-year goal is every kiddo coming into care gets a placement package, but we need your help to get there. So guys, thanks for tuning in. Laura, thanks again so much for your time, and I look forward to our conversation next week. And guys, thanks again for tuning in, and we'll catch you next week.